Welcome, everyone. Thank you for attending today's webinar, What's New in Commercial Tobacco Worksite Policies. I'm Susan Wiseman, and I'll be moderating and presenting during the webinar. I'm a senior staff attorney at the Public Health Law Center, where I provide technical assistance on policy issues concerning commercial tobacco in Minnesota and other states. I primarily focus on state policy, but I also assist on local level policy. I also conduct research and provide technical assistance on policy issues concerning healthy eating, physical activity, and health equity. I've been with the center since 2001, and I've had the good fortune to work alongside many dedicated and talented trailblazers in battling the tobacco industry on all fronts. Tobacco-free workplaces, youth access, retail sales, flavors, taxation, and access to cessation services. Pat McCone is one of those trailblazers. She is the Regional Senior Director of Health Promotion and Public Policy at the American Lung Association Upper Midwest and has worked with lung health programming for over 40 years. Pat has worked on tobacco cessation programs for adults and youth, limiting youth access to tobacco, public and school-based education, raising awareness of the impact of tobacco in those with mental illness and/or substance abuse disorders, as well as advocacy around limiting exposure to secondhand smoke, smoke-free housing, point of sale, and e-cigarettes. Pat founded the Leadership Academy, a statewide partnership between mental health and substance abuse and tobacco control leaders in Minnesota, working together over the past 3 years to address disparities related to tobacco in these populations. She was the 2017 recipient of the American Lung Association's Distinguished Professional Service Award, and in 2018, she was recognized as part of the Blue Cross Trailblazer Award. Natalie Hemerick is a staff attorney here at the Public Health Law Center. She provides legal technical assistance on commercial tobacco control issues in Minnesota, as well as throughout the country. She also works on federal tobacco control issues, encouraging the Food and Drug Administration to enact strong regulations and impose stringent enforcement to protect public health. Natalie chairs the center's Equity Committee, helping the center's staff work toward a shared organizational understanding of equity that is fully integrated into the work we do. I'd like to take a moment to introduce the Public Health Law Center in case you are new to working with us. We're based in St. Paul at Mitchell-Hamlin School of Law, located on land that is within the traditional homelands of the Dakota people. We provide legal technical assistance and strategic guidance on a wide variety of tribal, federal, state, and local policy initiatives to improve public health. We have 2 teams, one devoted to commercial tobacco and the other to issues concerning healthy eating, physical activity, and health equity. There are limits on the type of assistance we provide. We do a lot of legal and policy research to help develop policy options that are supported by scientific evidence, rooted in best practices, and promote health equity. We also assist with policy implementation and defense when policies come under attack. And we also develop a lot of publications which are available on our website, and we do frequent trainings and presentations such as this one. If we're not able to assist you, we will work with you to help connect you to others who can. We distinguish between the use of commercial tobacco control, tobacco sold at retail for general consumption, and the use of traditional tobacco, which is a sacred medicine for Indigenous people. Being mindful of cultural considerations and respecting traditional proper use of tobacco, traditions passed down for generations, is essential when forming tribal, federal, state, and local policies, including the sacred medicinal nature of tobacco plants for Indigenous people and the use of tobacco for prayer, offerings, and purification. The formulation of policy should promote understanding, respect, and community involvement. I had this slide out of order, I'm sorry. In all our work, we use a health equity lens, working in partnership with those in community we serve, looking upstream to consider social determinants of health, factors that determine health status and health outcomes affecting underserved populations, with the goal of achieving laws and policies that are fair and just, that eliminate rather than perpetuate inequities and improve the health of all people. Today, I'll be talking with you about the 2019 changes to Minnesota statutes. Pat will then talk about what employers need to know, and Natalie will address best practices for drafting and implementing worksite policies and policy opportunities. Then Pat will talk once more about strategies for outreach to work sites, and then if time allows, we'll open up for questions. In 2007, the Minnesota legislature amended the Clean Indoor Air Act by enacting the Freedom to Breathe Act to prohibit smoking of any form of combustible commercial tobacco, cigarettes, cigars, and pipes in nearly all indoor workplaces and public places. The stated purpose of the law was to protect the public and the workforce from exposure to secondhand smoke. The law has held firm since then. There have been no rollbacks in the years since. Earlier this year, the legislature amended the law to expand coverage to prohibit the use of e-cigarettes, or electronic delivery devices as they're defined in Minnesota law, as well as other lighted and heated products intended for inhalation, like Altria's new heated product, IQOS, in all places where smoking combustibles is currently prohibited. This was accomplished by updating the definition of smoking to include these products and by expanding the statement of purpose of the law to include protection from involuntary exposure to exhalation of aerosol or vapor. This legislation is a major public health win for all Minnesotans. Generally, the law prohibits people from using or carrying a cigarette, cigar, pipe, or any activated e-cigarette, or any other lighted or heated product that's intended for inhalation in indoor areas of nearly all workplaces and public places. The prohibition against smoking applies regardless of whether the products contain or are derived from natural or synthetic forms of nicotine, tobacco, marijuana, or other plants. No tobacco products, now including e-cigarettes, can be used in Minnesota's public schools and charter schools, or in vehicles that are owned, leased, or rented by schools. It's illegal to use or carry an activated, otherwise turned on, e-cigarette in these settings, and persons who are under the age of 18 are prohibited from being in possession of these products in school facilities and vehicles. The penalty for individual violations of the Clean Indoor Air Act is a petty misdemeanor, which is not a criminal violation under Minnesota law, but rather a fine of no more than $300. When the Freedom to Breathe Act was enacted in 2007, some exceptions were built into the law, allowing smoking in a few specific indoor environments. These exceptions are still in place. The only difference now is that the exceptions apply as well to e-cigarettes or other lighted or heated products in those same settings. In other words, in these limited settings where smoking is allowed, vaping is also allowed. We've lost our...
This one keep going.
Okay, I can't see the slides. I'm assuming that people on the phone can still see them? Mm-hmm. Okay.
Okay, go ahead. There you go.
Okay. When the Freedom to Breathe Act took effect, the Department of Health created separate frequently asked question fact sheets to provide the public with guidance on each of these exceptions. I've included the hyperlink to the department's main page on FAQs about the Clean Indoor Air Act. From that page, you can easily link to guidance on each specific indoor area where smoking is permitted, listed in the left side column. Just remember, in environments where smoking is permitted under the Clean Indoor Air Act, vaping is also allowed unless a local law has been enacted or an employer policy has been adopted that is more restrictive. And we're off track with the slides. We should be on one that, there we go. That's because, as you may know, Minnesota's Clean Indoor Air Act has a provision that allows local governments, cities and counties, to enact local laws that are more stringent than the restrictions in the state law. In other words, cities and counties are not preempted from enacting stronger policies than what's currently in place under state law. Cities and counties with more stringent policies that prohibit smoking in areas where smoking is allowed under state law, for example, hotel rooms, or an ordinance provision that might prohibit smoking within a certain number of feet from front doors, windows, and ventilation intakes, may need to update their definitions of smoking, if they haven't done so already, to ensure that the prohibitions on smoking extend to cover vaping in those restricted settings. The importance of this provision cannot be overstated. Your work at the local level not only helps your separate communities, but it also helps elevate state level policy efforts, helping to build momentum to enact statewide policy change. Minnesota policy advocates stand firm in protecting this provision from industry attacks. Last but not least, the 2019 changes to state law achieved a long-standing goal, establishing the administration of statewide tobacco cessation services at MDH to help Minnesotans who are seeking advice or tobacco cessation services to help them quit using tobacco products of any kind. Public awareness activities are included to highlight the available services and encourage people to use them. The cessation services may include, but are not limited to, telephone-based coaching, counseling, referrals, written materials mailed upon request, web-based texting or email services, and free U.S. Food and Drug Administration approved tobacco cessation products. All services must be consistent with evidence-based practices in tobacco cessation and must be coordinated with health plans, tobacco prevention, and cessation services that may be available to individuals through their health care coverage. And one last comment, changes were also made to tobacco tax laws, but we won't be covering those today. If you do have questions about them, please feel free to reach me directly at the Public Health Law Center. And with that, I'll turn it over to Pat.
Great. Thank you, Susan. And welcome, everyone. The sun is out, at least in northern Minnesota, and I am happy to be part of this important conversation. So a little bit about what employers need to know. I think it's anytime we start talking about tobacco is kind of who is smoking, who are using these products. Smoking prevalence. I mean, the good news is our work has really made a difference, and the Clean Indoor Air Act that was passed really impacted positively the work sites. And you'll see over the years, over the decades, the rates of combustible smoking prevalence in Minnesota and compared to the US. The one thing you might note on this chart is we were kind of really way ahead of the United States. And now when you look at 2018 data, we're almost at the same level. And I know, our roots in Minnesota, I always think that we're leaders on health issues. And we are, but we can do more. All right, next, there we go. So what kinds of products are being used? Well, for sure, we know that the combustible products are still around. But there is a transition, especially in our young adult population, to e-cigarettes, not so much with older folks. Smokeless tobacco, cigars, water pipes. Of course, those are very popular on college campuses. Boy, it's been a long time since I've seen a pipe except in Frosty the Snowman. But it's always important to dig a little deeper into the data because there are populations that have been left behind. And this is a really important slide showing the disparities among smoking prevalence. And again, these are smoking rates. You know, white, African American, Asian population at the lowest rate, but look at our Native American population have extremely high rates of combustible tobacco use. So always something to take in consideration, you know, the impact on other populations or minority populations. Here, I included this slide because I thought it was really important to go even a little deeper in that. Again, it shows that disproportionate rate among the American Indian population, but as you go down the slide, we also have the GLBTQ population in there. Those with that have high school graduation or a GED, we know that a really important predictor of tobacco use is poverty, and those rates go up. But I think the last three are really to take note. I remember the first time I heard this data was actually from our former Commissioner of Health, Ed Ellinger, when he was at the University of Minnesota. And he said the biggest predictor of binge drinking on campus is whether or not a student smokes. And that plays out with adults. There's a higher rate of tobacco use with binge drinking. And then an important topic that I'm really near and dear to is those with mental health, and it's Mental Health Awareness Month, very much so. And when you dig into those numbers, there are some populations within those people with mental health challenges that smoke at a rate of 80 to 90% within those populations. And those receiving Medicaid assistance, again, are considerably higher than that average. So numbers sometimes get tricky, and it's really what's deeper than that. So when we look by occupations, because I was talking about this yesterday and said, you know, our low-hanging fruit of work sites, like, of course hospitals are going to be smoke-free, right? But it wasn't that long ago that you were asked, just like at a hotel, do you want a smoking or non-smoking room at a hospital? But when we look now today, this is 2016 data, you'll see that food services, not surprising, construction and extraction, and a lot of those in our state are also outdoor workers, transportation and warehouses, manufacturing, and then I didn't want to leave out smokeless tobacco because of the high numbers in the mining industry. And then you'll see the emerging data we have on occupational use of e-cigarettes. And that's, again, accommodation and food services, because many of the adults who are current smokers that also use e-cigarettes, they're what we call dual users. They're smoking where they're allowed to smoke, but where they're not allowed to smoke, and now we've changed that in Minnesota, they're using e-cigarettes, or what we call dual users. And then construction is in there. I want to talk a little bit about our youth rates. Again, we've done really good work on this, lowering those rates in 8th, 9th, and 11th grade. And these are very new, this is very new data that we got just a couple weeks ago, down to under, you know, just around 5% for 11th graders. But again, you know, if we include all tobacco, and that's vaping products also, we see some real big changes. And I was asked last week about the numbers, and a reporter was saying he was looking at the 11th grade numbers, and I said, really what startled me were the 8th grade numbers, because this is a, you know, this is a dramatic increase, and an age when you're, like, the younger you start an addictive substance, the more likely you are to become a lifetime user. And 8th grade is very young, and we've almost doubled the numbers in 3 short years, and we do not see a leveling off at this point. So these are future workers. Some of them are our current workers. I know my kids had jobs when they were in high school, and something to be aware of. I do also want to talk a little bit about the vaping lung injuries that have been reported in the news. And now that we are talking about an epidemic, a word that's not used that often in tobacco control or in general in our society. But it truly is an epidemic, and I hope those numbers that I just showed you are showing you that the epidemic has not subsided. The CDC is keeping a weekly log. It comes out tomorrow, which is Thursday, updated. The legend here of the states is the darker the color, the more cases of lung injury that have been reported. And once again, I would say that the numbers are only increasing and increasing by the hundreds from week to week. And you will note that Minnesota is a pretty dark teal color there, and those numbers are increasing. In Minnesota, the Department of Health also has a website, a dedicated website to lung injuries, and I just got this from 2 days ago, the week of October 16th. The probable cases, you can see we've had 3 confirmed deaths, 2 which were confirmed last week, one of which I'm based in Duluth was here, and then cases under review, and there's actually delineation by counties. And of course, Hennepin County has the highest number there. I know you can't read all of these small ones, but I was talking with colleagues, even some of the very rural, more remote counties have cases reported in them. So if we also want to talk about health, there's an economic impact to smoking and healthcare dollars, and that should be very much on the radar of work sites and employers. We have a great report out that was put out 2 years ago by Blue Cross Blue Shield in reporting the number of deaths, the cost to the state, what that costs each adult and child in our state, and the Medicaid costs that were also. So these are really big numbers, most of which from this report are the combustible cigarettes that impact. But I think we're in a whole new era in collecting our data and showing impacts of nicotine addiction and the costs, the healthcare costs, and those ultimate costs that many employers incur. We've got some data on high range and low range. I always look at this as, well, how do we know? Well, I'll say I always err on the side of a little higher, and usually I'm below that. But this is data on what annual healthcare costs of a smoking employee is to a private employer. And as I recall, some of the instances I've had with working with employers, lost productivity, that means those many breaks that other workers complain about, like why do they get to go out and take an extra break? And kind of that unofficial, well, they have to, they're a person that smokes, but there is no right to smoke and to take extra breaks because you have an addiction to nicotine. But these are lost productivity, absences. I don't think it shows anything about loss to equipment or, I'll give you another example. The first time I worked with a couple hospitals, they first noticed that there was an excess laundry cost on the surgical floor and wondered what was going on there. And it turned out that staff was taking the warmed blankets and wrapping them around themselves and going out and smoking and then throwing them in the laundry. And it was a hospitality economic laundry expense that brought them to the table. So not everything is reflected in this chart. And then, I think when we talk about, I like to say nicotine treatment benefits, these are a really good investment for employers. They are very cost effective. If we can have a work site and benefits that really encourage and support ongoing treatment and ultimate cessation of tobacco, there is a cost savings in 3 years. It's cost neutral in 3, and you have a cost savings in 5. And these are lives, and these are people, and many of our friends and loved ones are people we work with. And it's important to really talk about these. It's the time of year a lot of employers are looking at packages and what they're going to offer. So I think that a really robust benefit package is really an important thing to consider, both economically and as a health benefit. And back to you, Susan.
Thanks, Pat. That was great. And now I'll hand it off to Natalie to talk about best practices in drafting and implementing worksite policies and policy opportunities.
Thanks, Susan. So first, I wanted to say that I'm going to talk about these policies and call them smoke-free policies. But oftentimes, what we're really talking about is employers who prohibit both smoking and then also any other commercial tobacco use, which would include something like smokeless tobacco, on their grounds by anyone and during the working hours of employees. So I'm going to refer to them as smoke-free policies for simplicity, but know that I'm not intending to suggest that they only should address smoking. They can also address other forms of commercial tobacco use as well. And I want to talk about some sort of threshold discussion of the authority to be able to implement these policies, and also some considerations that are important for employers to know as they're working on these policies. And first, as Susan was talking about the state requirements and how it's expanded to include e-cigarettes, there's nothing in the state law that would prohibit an employer from doing something that's beyond the state minimum standard for workplace policies. And secondly, important to consider is that if there's any unions or unionized employees or collective bargaining agreements with workers, those might require more discussion, notice, or negotiation to move forward with a worksite policy. So it's important to know for sure if that is in play and take appropriate steps to ensure that that is implemented in a way that is in accordance with those agreements. And also, the other consideration to think about is that Minnesota has a smoker protection law, and that prohibits the firing or refusal to hire someone who engages in otherwise legal activity, and that is specifically includes the use of commercial tobacco. There is an exception if it is a bona fide job qualification, but for the most part, you can't not hire or fire someone just based on their status as a smoker or the use of commercial tobacco. But in general, workplaces have like broad authority to implement these policies and for the protection of their employers and visitors to their property. So these are the general elements of a policy, and it's the typical elements of a policy, whether it be a local ordinance, a state statute, or a workplace policy. First, I want to talk briefly about the findings and purpose. Maybe I'm over-clicking here, sorry. About the findings and purpose, and then the definition section of a policy. Many of you have worked on policy, so you'll be pretty familiar with this, but I want to highlight this as well for the workplace policy because sometimes there's a specific pushback on both of these sections in a policy and a workplace policy because it's not something that is typically seen in other workplace policies. And so being able to articulate the reasoning behind having these is really important when you're trying to work on these policies with employers. The findings or purpose section is used to support the intent of the policy, and it usually mentions much of what Pat just talked about, the danger of commercial tobacco use and smoking, and the evidence that supports that using a policy to address those harms is an effective way to go, and also talking about the economics and the evidence for the economic impact of not having a policy. The other section that's very important is the definition section, and at times these can seem lengthy, and like I said, there can be a pushback against that. But I can say from firsthand experience working with different employers on these policies that the definitions are very important to ensure compliance and understanding. And with many organizations that I've worked with, employees are often looking for loopholes to prevent them having to comply with the policy. There seems to be a lot of concerted effort towards that. And so making sure that there are strong, clearly defined terms is really important in these policies. And like I said before, even if their other policies don't necessarily have a definitions or a purpose section, we highly recommend them for the smoke-free workplace policies. And our definitions, we are constantly reevaluating based on the trends and capturing emerging products and counteracting the attempts to circumvent the spirit of a policy. I want to dive a little bit into the typical definitions that you find in a worksite smoke-free policy. First, I want to talk a little bit more about smoking tobacco products and electronic delivery devices. Probably if you've worked with us or you've worked on any of our commercial tobacco policies in the local level, you've probably looked at these definitions and thought about these definitions, but I'm going to go through them a little bit more and explain sort of the importance and why we define them the way that we do. So first, looking at smoking, it captures using not just tobacco, but any nicotine, marijuana, or any other plant product that can be smoked. And it also covers the carrying or use of those products, including electronic e-cigarettes or electronic delivery devices. So that's important to ensure that you're capturing not just tobacco or nicotine, but you're also capturing sort of the wide gamut of things that could be smoked and could present health harms to other people. And if we look at the definition of electronic delivery device, the same thing is here, is making sure that it's comprehensive to include all the emerging products. So if you look at the definition that we're using here, it's a device that can be used to deliver any aerosolized or vaporized substance to the person inhaling from the device. So this is broad enough to capture not just e-cigarettes that typically deliver nicotine, but sometimes they deliver THC or marijuana. And there has been an emergence of other types of vaping, like essential oils and vitamins and herbs, areca nut, things like that. So it's important to let this be broad, and that a person, if they're challenged on their use of these products, couldn't just say, well, this is just flavors, or this is just vitamin C, and try to circumvent the policy. An employer does not want to have the responsibility and likely doesn't have the resources to determine whether that is just vitamin C or if it's nicotine or if it's THC. So it's better to make sure that you're banning the wide gamut of these policies so that the spirit of the policy is upheld. Finally, digging just a little deeper into the definition of tobacco product, if you look at this definition here, it's broad in that it covers anything that's made or derived from tobacco or nicotine. So also considering sort of what if synthetic nicotine is used. So if you're just using anything that's made or derived from tobacco or nicotine, you're covering that possibility. And it's it's crafted to capture the entirety of the class of products you wish to prohibit the use of. And then if we look at the rest of the definitions, these are more definitions that are typical for an employment worksite policy that you might not have come across before when you're thinking about policies that you've worked on if you've worked on local ordinances. And so these are also important to define. So property is an important one, and usually property means anything that is owned, leased, or otherwise controlled by the employer, and often includes private vehicles parked on company property or employee property. Defining who employees are, it's who you might think of, but you might need it to include like interns or volunteers. Those could also be considered employee for the purposes of the policy. Defining what's meant by working hours, and that is important because that typically means any paid time. It would not include unpaid breaks. And defining visitors, which usually is anyone that's on the property, that comes onto the property, that does not meet the definition of an employee. And the second part of or the third part, I suppose, of the policy is the restrictions and requirements, and that's sort of the meat of the behavior that the employer is prohibiting. For this part of the policy, the employer should decide who the policy will address. Will there be different requirements for different groups of people? If so, what, and what's the justification for that? Will it just cover smoking, or will it also cover the use of any commercial tobacco product, like I mentioned at the beginning? Will it also prohibit things like funding from tobacco companies or manufacturers, or if it's an employment place that does research, like research funding? Where is also a good thing to think through, where the employer would want to prohibit all this. A strong policy, as I mentioned before, would include any property that is owned, leased, or otherwise controlled by the employer, but it would also include private vehicles parked on property grounds. And when is also important. I mentioned before that you would define what working hours would be, and this is mostly pertinent to employees and whether the employee wants to prohibit the behavior no matter where the employee is. So if they're on a business trip or if they're running a company errand, as long as they're on the clock, they would be on paid time, and that could be considered their working hours. The next section is the exemptions, and we have a big use with caution here, which is an important note to discuss. I have a little bit of a graphic here for you to think through, because exemptions have a tendency to produce loopholes that employees may wish to exploit, or visitors could exploit. Two exemptions that we do encourage, however, are exempting the use of sacred or traditional use by Indigenous people, as Susan spoke to at the beginning of the webinar about respecting that use. And the second exemption that we encourage is actually allowing FDA-approved cessation devices. So to the extent that any of those devices meet the definition of like a tobacco product or an e-cigarette someday, not currently, but if it's an FDA-approved device for cessation, then that's okay to use, and you should definitely be encouraging that. And the last section is looking at enforcement and implementation. And this is also an important part of the policy process, and probably what will elicit a lot of comments from employees, especially about how this will be enforced and implemented. Many of the toolkits that are out there, encourage the use of employee listening sessions and engagement in the process. And these aren't necessarily for employees to try to negotiate new terms of a policy, but really just to ensure that people are aware of the policy rollout and have access to the resources they need to help them comply with the policy. So, and what that also involves is the discussion of how the employer will address supporting employees in their cessation efforts, and really trying to make a partnership approach to helping an addicted employee adhere to the policy through a holistic way. And then for enforcement, it's typical to ask visitors who do not comply with the policy to leave if they don't want to comply. And then for employees, it's typical to use the established standards that the employer has already made for other code of conduct violations. So going through that standard process for this policy as well. In addition to that, when thinking about how an employer is going to implement this, it's important to think about how they're going to inform people, not just maybe through listening sessions, but also through the hiring process, making sure that information is up front and that everyone's aware of it. And also for visitors, posting signs like the 2 signs that are here that can help visitors understand and also remind employees that this is a smoke-free and a tobacco-free area. Additionally, some toolkits recommend that employers do a walking assessment and look for commercial tobacco litter as a place that may take more monitoring, maybe having security go by there more often, or should have a sign indicating the policy more clearly. Overall, these are just some drafting tips for any policy, reminding you to use language that's clear and specific, and that is consistent with the goals of the policy, engaging employees and stakeholders in the process, and being ready for the pushback on the policy with an understanding of the reasons of pushing forward with the policy. We have some resources on our website to help with this, and we're also always happy to help as a TA provider, help with drafting these policies.
Thanks so much, Natalie. That was really terrific. Now we're going to go back to Pat, and she's going to talk a little bit with us about strategies for outreach to work sites.
Thanks. We're on the home stretch, as they say, and we're leading the race. How's that? So strategies to reach out to work sites. I think the really important question is, do we want change or do we want to keep it the same? And, you know, it's the old Dr. Phil, well, how's that working for you? And with tobacco use, we really have a very different environment, as I said before, about the vaping. And just this week, these new devices, the heated cigarettes, you know, they've been approved for a little while, but now they're launching their media campaigns and advertising campaigns, and it won't be long before you see them and I wonder what that is. And that would be your homework assignment. Go Google it, IQOS. So change or the same, and we definitely want to have change so we have better health outcomes, our ultimate goal. I think there's lots of benefits. I think one of them is actually to protect yourself from future litigation, because we know so much about exposure to secondhand smoke. We know so much about tobacco that we really want to do our part. I think there's individual parts, there's part that the community does in that community environment, and there's corporate parts. And this is that work site where most of us spend a big part of our day. It's a positive image. It really does reduce healthcare costs and workman's comp claims, and increases if you own the building or your properties, all of that. I'm not gonna read the whole list to you. Lots of positives, very few reasons besides kind of fear of what might happen if you move forward. We always think of the worst case scenarios. Well, what if somebody does this? And I'm working on a policy, and somebody said, well, what if they're out on the ice skating rink? That's a lake. Is that part of the property? It's like, okay, well, that's, you know, not a reason to hold up a policy that would be protecting lots of others. I think you always have to consider what's going on in the workplace and your stage of readiness for change. I'm a big believer in including input into the process. These listening sessions that Natalie talked about are important, including employees that smoke in the conversation of not if this is going to happen, but how it's going to happen. That's the real important. The decision about doing it should be steadfast. The how we get there and those steps of really respectful engagement and ways that we can be supportive of all employees. And I really like to look at this as the whole picture of a wellness program. Use that readiness, and then of course talk about the benefits that are available. And I would encourage each of you to think about right now, if you were the person that was using tobacco or your loved one on your policy and they wanted to quit today, do you know what your insurance policy covers? Do you know what your copays are or aren't for this? So if you don't, I guarantee you employees don't. So I think one of the things is, even if you do nothing more, is that you regularly inform employees of what this benefit is and what it covers. What's a timeline? Some people say, let's do it tomorrow. Well, no, let's plan a while, not forever, but a good 6 month to a year timeline on some of this is really important to get it right. Think about special circumstances. Maybe you're building a new building. Maybe you're moving your office. Maybe something's going on. That's a natural time to say, and when we do this, we are also going to implement this policy. So good to think that over. Also think about the weather. I mean, I often said, if you go tobacco-free grounds and it's your implementation date is January 1st, it's going to be more challenging than if it were June 1st. Let's put it that way. All right. And then are our efforts intertwined, or are they really looking holistically? When I think about what impacts and why people that use tobacco talk about what it does for them, one of the things they talk about is stress, that it relieves stress. Well, it does because they're in withdrawal, but it also does because they take a break, they deep breathe, and a stress management program can be very beneficial to the person that's thinking about addressing tobacco addiction, nicotine addiction. The same with active living and eating. Weight gain is a common concern for people that are in the process of quitting tobacco. So I would encourage you to think broader than let's just offer a class, is that these skills are important skills when it comes to the employee or the individual, applying them to that process of quitting tobacco. Yeah, we've got one of those toolkits. You're legitimate if you've got a toolkit, and we've got one. It's free. It gives a lot of samples and questions to just review. The whole process is there. It's very well done. I think it could be a little more updated, and we'll be doing that on the e-cigarette and vaping products. And of course, these new heated cigarettes. Remember where you heard that. You heard it on this webinar. And then we also, as the American Lung Association, have cessation resources. You just go to lung.org. We have online, we have in person, we have a self-help guide, and we also have a helpline that's available to anyone. And I want to encourage, again, when Susan shared what Minnesota offers for nicotine dependency treatment to all of our residents. They are robust services. All right, let's see what our time, oh man, wrap up. Just like a present. Do it, Miss Susan. Put the bow on it.
All right, thanks, Pat, so much. And while we're looking to see if there are any questions in the queue, let me just pull up our contact slide and encourage you to reach out to us with any questions you might have that are not addressed here during the webinar. And to sign up for our newsletter if you're not already on our list.
Yeah, I want to give another shout out to, while people are thinking of those questions, opportunities. November, the Thursday before Thanksgiving, is always the Great American Smokeout. That's a really good time to promote awareness about your benefits, your health benefits, and or your policies. A very common time when people quit smoking are those New Year's resolutions. There's lots of opportunities annually to weave these messages into employee communications. So just want to be sure you know about those.
Great. Pat, I'm going to ask you, if you could only make one recommendation, what would it be?
It would be don't wait. These, new products are seem to be more socially acceptable, and don't wait until they're already a problem before you incorporate them into your policies and address them. Proactively, it's the inoculation theory versus the treatment theory.
Mm-hmm. For sure. All right, now the question for you is, what about smoking in personal cars on company property?
that would be considered a strong policy to also include that, because if you think about it, the emissions and all the things that are happening, it's happening like still in the space of the company property. And so many policies do prohibit that in personal cars on company property.
I think that's a growing trend,
Yeah.
I would say. Anything else on that?
No, nothing specific.
All right. So we have a question asking, as our ship partners talk with employers, what are the top few things they should check in with them about? Should the policy include vaping devices, grounds in the policy, the grounds of the place of employment, and anything else? And I'll open that up to each of you. Why don't we start with Natalie?
I guess I'm not exactly sure what the question's asking, but it seems like to me that as you're just starting the conversation and trying to engage employers, you're probably talking more about the stuff that Pat shared to try to emphasize the importance of these policies and why they are important to consider. And then when there's some, agreement that this is something they're interested in, then really get into the more the nitty gritty of what the policy would or wouldn't include. But, just a lot of people are really aware, and Pat, I don't mean to take your answer or anything, but a lot of people are really aware now with the lung injuries and things like that, that vaping is a big issue. So that could be a really good, in to sort of discuss why they would want to consider having a worksite policy to address this.
Yeah, I agree. I think one of the positives about the epidemic that we're in is the opportunity to talk about this with people, employers, and I think a lot of them would be very open to talking about the devices and whether or not to include them. And the new law, they may not all, we live in our tobacco bubble and we think everyone knows what's going on, but not everyone is aware that the Clean Indoor Air Act was amended this last session to include these devices or about these new devices coming. I think that that would be really helpful information to them. And then I would listen to them, what they're saying there, if they're running into any kind of, what I tell my grandkids, we've got a situation, if they've got hot spots that they're looking to address, all of those, I think those first meetings are best listening opportunities and then coming back with resources for them.
I thought I would add that for employers, trying to create a culture of health in their workplace environment and involving all employees, regardless of their habits around tobacco use, is really, I think, a powerful way to move these policies forward. I really liked what Pat had to say in her slides about addressing things like stress management and healthy weight. And I would add like conflict resolution. These are all the types of triggers for tobacco use, and but they're also triggers for other types of substance abuse and just generally good practice for creating a culture of health is to bring people together around those things. And I think when everybody can see positives, then the policies are more likely to succeed. Let's see, we have a question. So someone asked, he or she is going to talk with county commissioners about Tobacco 21 and would like to know what are some of the policies to consider and talking points to raise at that meeting.
I think that probably you should reach out to us and probably Pat, depending on who your advocacy TA provider would be, to work on that. But yeah, we're happy to provide the technical assistance on that issue, but that's probably beyond what we can get into right now with the few minutes we have left. Pat,
I'm happy to also very welcome to have that conversation with a follow-up phone call, very much so. I know both of my children worked in fast food industry when they first started work as not young adults. They weren't even 18 yet. And I think, to me, that has a connection between Worksites and Tobacco 21. And some of the first places young people learn to smoke is on breaks at fast food employment sites. So hopefully that's changing.
It's a hard question for us to respond to because we don't engage in any lobbying. And so we really look to the advocates to have those.
Well, I can lobby, so they give me a call.
Yeah, they can call Pat on that one. I don't think we have any other questions in the queue. Any closing thoughts, Pat or Natalie?
Well, I'm going to go back to that county commissioner wanted to say, this is another good opportunity to talk about the epidemic. And really, that is, if there's any benefit, it's that benefit, and that and something that the Public Health Law Center brought up, that we really do our work at the local level and to not wait for other entities to make that decision. So that's universal across work sites and or in our communities. We're all working together. So thank you.
Yes, we're inspired by the work that's being done at the local level, very much so, day in and day out. So we'd like to thank you for participating in today's webinar. I didn't mean, did you have anything else?
No, that's
Closing
good.
remarks?
Finishing closing marks from Pat.
All right. Thank you, everyone. That'll conclude our session today.
Thank you.